All right, welcome everybody back to the brain injury discussion. This is your host, Jay. Today we're going to talk about brain injury and cognitive behavioral therapy. One of the things that you should know, either working with or as a brain injury case manager, is how we change the mindset, as well as how do we adjust things that aren't medication? What are the things we can do aside from medications? Again, I am not a medical doctor or a medical provider, but I could offer some suggestions to help the environment around someone and, develop goals and actions that could help someone achieve their goals, maybe if their brain has been injured or maybe their brain is not at 100%. So, this is a way that we can look forward to uh, being able to address issues without having to go to a medication. Medications don't solve every issue, but like always, sources will be in the description below, as well as we'd appreciate feedback in the form of a like, comment, and maybe subscribe to the channel. We put out this information weekly. But with that being said, we have a lot to get into, so let's get started. So, how did cognitive behavioral therapy or CBT first come out? Well, it was designed by a guy named Aaron Beck in the 1960s. So, this has been around for about 60 years and counting. So, we know that this has been around and it is utilized in a multitude of different fields. Again, we're thinking about how cognition and behavior kind of connect with each other. This is a lot more neuropsychology related than just psychology. So, what we see here in the definition is it is a type of psychotherapy that helps individuals identify and change negative thinking patterns and behaviors that contribute to mental health conditions. Again, how do we sum that up? It is changing the thinking behind the actions. So, cognitive behavioral therapy usually has three parts involved, and we're thinking about someone's innermost thoughts, again, how they're thinking, um, someone's behavior, emotions, which we say it comes from the heart, it's really from the brain, and then their behaviors as well. And so this kind of goes back and forth between each other. And when we realize that this is all brain connected, that's why brain injury case managers are very essential when it comes to cognitive behavioral therapy. We're able to see the injury and advocate for that injury and specialize in that injury, which again, emotions, we say it's from the heart, but it's also from the brain. Same thing with the thoughts, it's in the brain, and behaviors, what comes from the brain. And so, again, the definition is quite long, but it changes negative thinking patterns and behaviors. That way we can adjust them to positive thinking patterns and behaviors. But those are the origins of cognitive behavioral therapy. Let's look at a few examples here. Let's see how we can change a few things for the better. And let's think changing thought. Now, some might struggle with the VA and their disability claims, and they might think, well, I was ignored or neglected. Well, they have to deal with a lot of claims. So let's rephrase that into they might have been busy. Maybe you didn't hear back from that job application right away. Instead of saying I was ignored, say, well, they probably got busy with something else, especially if they're looking for another worker in that job. And so we need to keep these things in mind. Also, we can help change someone's feelings or emotions from I feel sad to the situation is sad. Maybe you don't get a job, or maybe the VA claim is taking too long, or whatever the situation is. Yes, it can make you feel sad, but sometimes it's just the situation. The situation can be sad, and that can change how you feel about a subject. So we change the thought, we change the feeling, and then we also look at the behavior. Okay. A prime example of this, is the phrase, I can't do this. Now, in boot camp, they'll say, you can do this. Your mind is telling you you can't. Again, this is another one of those cognitive behaviors linked to behaviors. This is brains with actions. And so instead of saying, I can't do this, we should examine it from the perspective of I should try or I should attempt to do whatever this is. I should try to do those extra 10 push-ups, or I should try to apply for this program, or I should attempt to apply for this job, or so on and so forth. You can take this phrase and apply it to a lot of things in life, but all these things are problem and goal oriented. So you're addressing the problem and presenting a goal. Think about the problem of being ignored. The problem really is that they were busy. All right. The problem of feeling sad, that's a problem. Well, it's a goal. Hey, let's change the sad situation. The problem is, you don't think you can. Well, the goal is maybe you should try. You never know until you will try. And so this could be very helpful to brain injury survivors um, who might assume that maybe this is impossible. Maybe it's hard instead of impossible. Those are the ways we can reframe thinking for the better. And this could be used not just with brain injury survivors, but also with people who don't have brain injuries. Think about the applications of this. Again, this isn't necessarily just being glass half full. This is reframing the issue or reframing the problem and creating a goal. So let's move on and let's talk about why this really does apply to brain injury. And we're talking about things that come from and interact in the brain. And cognitive behavioral therapy is preferred therapy for brain injury linked behavior. Think about that person who had a change in their personality or in their actions or in their inhibitions or lack thereof. Um, when it comes to brain injury, maybe they shut down when you talk to them. Again, that could be behavior linked to the brain injury, and cognitive behavioral therapy can help address some of those changes. Obviously, this works on a multitude of behavioral symptoms. All right. We're thinking about those disinhibited people. We're thinking about people who discombobulate, or maybe, discombobulate, they're pulling things and filling in gaps with whatever memories they do have. Maybe they're disinhibited. Maybe they do not act as they would prior to that brain injury in public. Maybe they're a little bit more forward. Maybe they're a little bit upfront and honest. Again, we're work on the behavior through the cognition. Obviously, this is very helpful for behavioral sequelae as well as cognitive sequelae. Again, sequelae being the after effects of a diagnosis, in this case, brain injury. But think about what might change in a person. Think about those after effects after a stroke, after a hypoxic event, after that blow to the head. And think about the changes that might come out of that person. And some of them might not be great. And so cognitive behavioral therapy adjusts our thinking as well as theirs to help adjust and to adapt really to those changes. But really, this is useful to help with daily challenges. Your life always has daily challenges. You got to wake up, and if you got something to do. So for me, it's making my morning coffee. Having the coffee maker ready helps start my day off easier. And so that is a little 5-minute prep session that I can do before I go to sleep or whatever. Cognitive behavioral therapy helps, that could mean the difference between getting to work and to an appointment on time or being late. And so those are things you might want to keep in mind when it comes to cognitive behavioral therapy. Just things, small things, right? But they can make a world of a difference. So, what do we see as the results of cognitive behavioral therapy as far as brain injury survivors are concerned? Well, what we see is there's a reduction in the severity of post-traumatic stress disorder or post-traumatic stress. Again, car accidents can cause PTSD. Major medical accident can cause PTSD, and that can be a very serious thing. We also see that it also improves post-traumatic amnesia or PTA. All right, it helps um, reduce the amnesia and bring back or facilitate, hey, this is what happened when you were out. Okay, that's instead of having to fill in the gaps or discombobulate. We also see statistically it improves anxiety and depression. But we also see that it increases the ADLs or activities of daily living. Again, those activities of daily living, they might seem small, but being able to make your own coffee in the morning is a thing that, provides someone with some level of independence. You don't have to have your coffee made for you. That's independence right there. That's something that might mean something to that person. We also see a general reduction in symptoms pertaining to the brain injury, like sequelae. And it also helps people accomplish goals, life goals, small goals, big goals, um, other goals. We see that this is useful. So, what does this lead me to conclude as a brain injury case manager? Well, there are a lot of simple solutions around thinking that exist and they work effectively. They're not complex, they're not pharmaceuticals. They are ways to readjust someone's thinking, readjust how do we change our thinking around this. And the results and the actions and the behaviors tend to follow suit. Hey, I was ignored by the VA. No, they probably just got busy. My doctor's office didn't call me. Well, they probably had more important things to do. And simple things like that can help change our mindsets and our behaviors. Also, we need to think about changing the thinkings and actions and not just medications. We should not rush to pharmaceuticals. That is between you or the person with a brain injury and their doctor. This is not My lane does not include medication at all. In fact, I want to facilitate uh, people living their best life possible, fulfilling their life and their goals. And medications might have a role to play, but it's not my role to play in that medications. My role could be simply rephrasing it as, well, maybe the nurses were busy to call you. Maybe let's set up that MyChart account instead. Let's be able to facilitate some independence and integration into the community instead of just throwing medication at the wall and seeing if it works. Again, medications are important. It's not my lane, it is the lane of a medical doctor. Also, we need to think about emotions and feelings. They are in the brain. And think about how they're all connected. As we see in this graphic here, the world is in your brain. Your thinking, your games, your education, science, light bulb goes off in your head and so on. All of that translates to action and it's all pertaining to the brain. That's why brain injury and cognitive behavioral therapy are very much linked together. And I would certainly like to see more of the emotions being not just the heart, but also the brain as well. And so this leads me to kind of my final point, which is think about the person. We are person centered here. Think about the person, not the injury. Someone is a survivor of a brain injury. They're not a brain injured person. They are a survivor of the brain injury. They're not brain injured person. So they are themselves. They just happen to have that condition. And again, that's a very humanizing phrase. Again, we take it with the veterans context. Hey, this man is a veteran, not just someone who served in the military. All right. It's part of their identity. Let's think about the person when we're doing this, when we're developing these plans for cognitive behavioral therapy. So, with that being said, I'm going to leave it on that note. Here are my references. I appreciate any and all subscriptions to the channel. We'd love your feedback. Feel free to give this video a thumbs up and also drop a comment down below if this maybe helps you with your thinking. But with that being said, I hope everyone has a wonderful day and don't forget, protect those brains.